Okay, now coming to this clinical vignette, if you see over here, what is it saying? An old man has trouble in walking. At his physician clinic, when he is asked to stand on right foot, then his left hip drops. Now this is a very important key point over here. On examination, this kind of examination is done. He is asked to stand on the right foot, and when he is standing on the right foot, the left hip drops. Now you can very well tell that this is the Trendelenburg sign. It is a Trendelenburg sign, and the clinician is basically testing this sign, that if this sign is positive or not. And when we are talking about this sign, we are actually checking which nerve. We check the superior gluteal nerve. We are checking the superior gluteal nerve. And when we talk about this sign, now this is a picture which is showing that this is the normal person. This is also the normal person. So when in the normal person, if we see over here, when this one of the foot is on the ground, we say, for example, if I say this right foot is on the ground, then the pelvis is lifted towards the opposite side. So on the opposite side, the pelvis is lifted, and this is because of this normal muscles, the gluteus medius and the minimus, which is supplied by superior gluteal nerve. They are maintaining this pelvic stability, and they help in lifting of this pelvis. So the pelvis is lifted on the left side. Now over here, this is the one which is abnormal and where the lesion is there. So you are having the lesion at this level. The lesion can be of the nerve, or it can be fractures at this point, or they can be various other reasons also. And the main thing is that over here we are actually talking about the superior gluteal nerve. If that superior gluteal nerve is injured, the gluteus medius and minimus, they will be affected. And now when you ask the patient to stand on one foot, for example, I say on the right foot, now this medius and minimus, they will not be able to act, and the pelvis will fall down. The pelvis will sag down or fall down towards the opposite side. So this is the left side. So it is sagging down towards the opposite side. This is a typical Trendelenburg sign, that this sign is positive over here. And if it is positive, it shows that the superior gluteal nerve injury will be there, and the medius and minimus, it is paralyzed. So now let us come back to this question. So if he is saying that he is standing on the right foot and the left hip drops. So that means, what does that mean? The superior gluteal nerve of which side is affected? The superior gluteal nerve of right side is affected, and due to that, the right sided gluteus medius and minimus, they are paralyzed, and due to this reason, they are not able to lift the pelvis, and the pelvis falls down. So we say the left hip, it actually drops. So the pelvis falls towards the opposite side. So what will be the answer over here? It will be the involvement of right superior gluteal nerve. It will be involvement of right superior gluteal nerve. So for the superior gluteal nerve injury, regarding the superior gluteal nerve injury, now which muscles are paralyzed? Gluteus medius and minimus, they are paralyzed. They are paralyzed, and due to this, the chief action which is performed by these muscles, this is also affected. So there is loss of abduction at hip joint. You can say the loss or weakened abduction at the hip joint. And apart from this, what will be there? The Trendelenburg sign is positive, and pelvis sags towards the opposite side. So when a person stands on the affected side with the foot on the affected side, then the pelvis will sag towards the opposite side, and the walking pattern of the patient is also changed. What is a walking pattern? It can be, we use the term as lurching gait. The lurching gait, when unilateral involvement is there. When unilateral involvement is there, then we say the lurching gait is there. And if I say that the bilaterally both the nerves are involved, in that case waddling gait will be seen. In the bilateral involvement, the waddling gait will be there. So what is happening in the unilateral involvement? The pelvis falls on one side. So when the patient is walking, he is lurching on one side. Okay, so the lurching gait is there. When we talk about the bilateral involvement, the lurching is, or the falling of the pelvis is towards the both sides. So it is given the term as waddling gait.